Welcome to Catalyst Made Up, where we ignite understanding and make learning easier. In our today's class, we'll be looking at internal thoracic artery. Internal thoracic artery, it is also called, or it is also known before as the internal mammary artery. It is a pair of the artery located in the anterior aspect of chest. It supplies the thoracic wall and the anterior abdominal wall through its branches. So that is short introduction to internal thoracic artery. The origin of this artery originated from the lower border of first part of subclavian artery, opposite the origin of thyrocervical trunk, about 2 cm above the sternal end of the clavicle. That is the origin of the internal thoracic artery. Cause of internal thoracic artery. The causes of internal thoracic artery is that it descends behind the medial end of the sternum and the first costal cartilages and runs vertically downward about 2 cm away from the lateral border of the sternum up to the 6th intercostal space. In the 6th intercostal space is terminated by giving off 2 terminal branches, the superior epigastric artery and musculophrenic artery. So from here is our subclavian artery. We say that it arises from the lower border of the first part of subclavian artery opposite the origin of thyrocervical trunk. Above here is our thyrocervical trunk. So below the thyrocervical trunk, that is where the internal thoracic artery originated. And we said it runs downward behind the lateral border of the sternum up to the 6th intercostal space. This red line here is our internal thoracic artery running vertically downward at the lateral border of the sternum up to the 6th intercostal space. In our 6th intercostal space is divided into 2 terminal branches, the superior epigastric artery and the musculophrenic artery. This is our superior epigastric artery. And this musculophrenic artery as the terminal branch of the internal thoracic artery. That is about the cause of internal thoracic artery. Now, the relations of the internal thoracic artery. We said that the internal thoracic artery runs in the anterior aspect of the chest, and there are 2 internal thoracic artery. There is right internal thoracic artery as well as the left internal thoracic artery. Now, the relations of internal thoracic arteries is as follows. Anteriorly, there is some structure that is run behind them, and there is some structure that is runs in front of them. It runs behind the structures such as the medial end of clavicle, brachiocephalic vein, internal jugular vein, pectoralis major, upper cyst costal cartilage, external intercostal membrane, internal intercostal muscles, as well as the phrenic nerve. It runs behind all these structures, but runs in front of one structure called the cervical pleura. So these are the anterior relation of internal thoracic artery. Now, the posterior relation of the internal thoracic artery are as follows. Before the second costal cartilage, it has relation with endothoracic fascia, and the pleura. whereby after the second costal cartilage, it has a relation with sternocostallis muscle. It has a relation with sternocostallis muscle, and this muscle is the one that separates it from the pleura. So that is all about the relation of the internal thoracic artery. Up next is the branches of internal thoracic artery. The internal thoracic artery gives off 6 branches, which you can remember using the mnemonics MAP, SM. You can remember the branches of internal thoracic artery using these mnemonics MAP, SM, where our M stands for mediastinal branch or the mediastinal artery. The A there stands for anterior intercostal artery. The P there stands for pericardiophrenix, and the second P here stands for perforating branch. Our S there is superior epigastric artery, and the M stands for musculophrenic. So these are the branches of internal thoracic artery: the mediastinal branch, the anterior intercostal artery, pericardiophrenix artery, the perforating artery, superior epigastric artery, as well as musculophrenic artery. This mediastinal artery is just a smaller and irregular branches of internal thoracic artery which supplies the fat as well as the thymus that are present in the pericardium. The anterior intercostal artery runs behind the upper 6 intercostal space and gives us 2 anterior intercostal artery to the upper 6 intercostal space. The pericardiophrenix artery arises near the root of the neck, and it follows the phrenic nerve up to the diaphragm, and it supplies the pericardium and the pleura. The perforating branches they follow the anterior cutaneous nerve, and the perforating branches of the second, third, and the fourth intercostal spaces in the female, they are very large because they supply the mammary gland. Superior epigastric artery, the superior epigastric branch of internal thoracic artery enters the rectus sheath by passing between the costal and the sternal slip of the diaphragm and anastomosized with inferior epigastric artery. Musculophrenic artery. The musculophrenic artery runs behind the 7th, 8th, and the 9th intercostal artery and gives off 2 anterior intercostal artery in those spaces. And it also pierces the diaphragm at the level of 9th costal cartilage and anastomosized with the arteries that are found underneath the diaphragm. It also supplies the diaphragm. So these are the branches of the internal thoracic artery. From here, this is our subclavian artery, the first part of subclavian artery which gives rise to the internal thoracic artery. The branches here are the perforating branches. Perforating branches, and the upper 6 intercostal space, the first, second, third, fourth, fifth, and the 6th. They are the anterior intercostal arteries, whereby at the 6th intercostal space we say that the internal thoracic artery gives off 2 terminal branches: the superior epigastric artery and the musculophrenic artery. The musculophrenic artery gives off 2 anterior intercostal artery at the intercostal space of the 7th, 8th, and the 9th space. So these are 7th, 8th, and the 9th space, and this artery here are the musculophrenic artery. So up here is the pericardiophrenix artery, which we say that arises near the roots of the neck, and it follows the phrenic nerve up to the diaphragm, and it supplies the diaphragm as well as the pericardium and the pleura. So this is about the branches of internal thoracic artery. Clinical correlation of internal thoracic artery. One of the most important clinical correlations, apart from supplying the thoracic wall as well as the anterior abdominal wall, it is very useful during coronary artery bypass grafting. Coronary artery bypass grafting. During coronary artery bypass surgery, the internal thoracic artery is the most preferred graft, especially to the left anterior descending artery. It is most preferred graft because it has the diameter that is similar to the coronary artery. It also has high resistance for atherosclerosis, as well as it can stay open for a long period of time. Clinical correlation of internal thoracic artery is that it provides collateral circulation during aortic coarctation, that is coarctation of the aorta. During the coarctation of the aorta, that is the narrowing of the aorta, it provides a collateral circulation. Also used in reconstruction and plastic surgery. Some branches of the internal thoracic artery, they are used in breast reconstruction as well as chest wall flap. So those are some common clinical correlation of internal thoracic artery. This is an overview of the internal thoracic artery. Kindly subscribe, comment, like, and share. Don't forget to turn on your notification bell so that you don't miss any new video.